Hello, I'm going to be introducing you to a concept that's crucial in tying good sutures that will stay for dental suturing. And that is making sure that we can always tie what's considered a nice flat knot. Looking at sutures, there are two distinct kinds of knots that we can create. You have what are called flat knots and non-flat knots. We always want to create flat knots if at all possible, because what that allows us to do is have a suture that will maintain good tension and will not slip on us. So for example, a flat knot would be what we would consider a normal square knot. If you look at how I've tied this, both the going and coming ends of our rope both depart the knot or the bite on the same side. And what that does is it allows me to slide the two independent loops separately. And if the other thing you'll notice about a nice flat knot is if we consider this as going to be what's down into our tissue, the tail, both the side that's the shorter end and the side that's going to our needle, are going to be pretty much staying in line with our suturing loop. They'll slide like this, and it looks essentially the same if we tie what would be considered a traditional surgeon's knot, where we will have two overhand knot with two loops to it, followed by one. You'll see this is your traditional surgeon's knot, which would be a 2-1 knot. And then if we go ahead and tie another one on top of that, bring it back over, and it would come around this direction. We now have another single overhand knot on top of it. And what you can see is my tails are still in line with the suture itself. To tie an example of what would not be considered a flat knot, the most common one that you'll run across if you ever had done knots for sailing or anything like that would be what would be considered a granny knot, where the bites are departing, or I should say entering the loop and departing the loop on opposite sides. If you look closely at our bite right here, you can see that they're coming and going on opposite sides of the bite or the loop that goes around the end. What that does is it doesn't slide very nicely like our square knot that was flat originally would. And now what you'll notice is as I tighten this up, instead of the tails being in line with the suture itself, they actually are kicked off almost 90 degrees. This is a telltale sign when we start doing our delicate dental suturing, and sometimes it's very hard to see what your knot is composed of. It makes it a lot easier to see if you've tied a truly flat knot or not by looking at and examining where your tails are coming from. This is what we want to avoid when tying dental sutures. This will tend, with some of our slipperier materials, this will tend to slip out. It doesn't particularly with this dog leash that I happen to be using, but it's not nearly as self-locking as a flat knot generally would be. Now the real trick is being able to consistently tie a nice flat knot when you transition to utilizing Castros or needle drivers and doing it from differing angles within the mouth. Now that we know what flat knots are and non-flat knots, and know that we always want to be tying flat knots anytime we're suturing for dental purposes, the tricky part now is figuring out how to transition to making them each and every time we're in the mouth. You see all kinds of crazy things, and I was taught some of these in dental school, where you always want to go clockwise to start with, and then followed by a counterclockwise, and then another clockwise. Well, the tricky part is unless you're pulling the tails the same direction and approaching your suture the same every time, it gets very tricky to make sure that you're actually tying a flat knot. So I'm going to introduce you to a concept that I was taught in periodontal residency for making sure that each and every time you're tying a flat knot, regardless of where it is in the patient's mouth and what direction you need to start with the tail, the needle, etc. So the concept is called keep it in the loop. And what we need to think of and be aware of is, I've just got this little case right here indicating like my trans tissue portion of the suture, and we'll say up towards the top is my tail end of the suture, and down below me is the infinite end that's connected to the needle, let's say. So what we need to think about is when we utilize the concept of keep it in the loop, we're looking at our loop that we're going to be tying is right here. It's right across where our suture line is, what we need to affect. It's just like tying from one side of your shoe to the other for your shoelaces. And what we need to do is every time we enter our needle drivers into the patient's mouth, or Castros or whatever we're using, we want to make sure that we are entering the loop from the exact same direction. That can be from the superior aspect, that could be from the inferior aspect, anterior, posterior, mesial, distal. It really doesn't matter as long as for each 3 throws of our knot, we're approaching from the same direction. So if we're going to enter the loop right here, we're always going to be entering for this example, we'll enter the loop from the right hand side. So we're always going to be taking our needle end of the loop, and that's what we're going to be wrapping, correct, around the needle driver, and we're going to grab our tail end. So if I come into my loop from the right hand side, I can only wrap the long needle end of my suture around this one direction. If I'm wrapping it the other direction, then I've started on top of the loop, and that's not correct. So as long as we come in, keep our needle drivers right, even with our tissue, we can only wrap around it one direction. Now in that case, I'll grab my tail end, and the tail started out up on top. The tail always needs to end in the opposite direction for each throw of our overhand knot. So now my tail is down here below, and my needle end is now up here. So now my loop is right on top of here. So I enter the loop from the same direction, from the right, I do a single wrap around it, I grab my tail, and now my tail started down here for this throw of the knot. Now it needs to end up top. And you can see we've created a nice overhand surgeon's knot. This would be, so far, this would be 2 throws initially, 1 throw, so this would be a 2-1 knot. And you can see everything's nice and in line. They're entering and exiting on exactly the same side of our loop, or sorry, the bite and the knot. So now we've created a correct surgeon's knot, and it's a flat knot. So now let's say we want to do a third locking throw, so make it into a 2-1-1 knot. I come in, my loop that I'm going to tie is right here, so I can only come at it from the right hand side, or coming from the right hand side I can only wrap in one direction. So now I'm wrapping over it, my one loop. My tail is now up on the top. Now I need to pull it towards me, and now you can see we've created another square knot right on top of our surgeon's knot. And we have a nice flat knot that will hold regardless of the material and how slick it is. Now let's do another example of the same idea. So now we've created a situation where we need to come from the bottom, which would actually be opposite where we were coming from the right hand side of our tail before. Regardless of where you're coming into the patient's mouth, as long as you're consistent with how you enter the loop with your needle drivers, Castro, whatever you're doing, it's always going to allow you to tie a flat knot. So in this case, we're going to enter our loop from the inferior aspect. So now when I'm in the loop, I can only wrap one direction around my needle drivers. Let me grab my tail right here. My tail started on the left-hand side and now needs to come to the right. Wiggle it through here. So now you can see we've got a double throw here. So now I'm going to enter the loop from exactly the same direction. I can only wrap around it one direction while keeping it in the loop. Grab my tail here. Tail started on the right. Now it needs to end up on the left. So there we've created a nice single flat bite here. So now we have a 2-1 surgeon's knot. And now if I'm going to continue coming into my loop from the bottom, the inferior aspect, I can only wrap around there one way, keeping my needle driver. Now my tail started on the left for this throw. Now it needs to come back to the right. And now we've created another nice flat suture on top of here. So we've got a 2-1-1 knot that will hold in a variety of materials. As regardless of what direction, as long as you're consistent coming into your loop for the suture, you will always tie a flat knot because you can only wrap the long end, the needle end of your suture around your needle drivers one direction. So now that we've done the big example of that, now we can do it with showing an example of a dental suture. So I'm going to zoom in here a little bit. I've got some 4O Vicryl. I don't normally use a lot of Vicryl, but it shows up very nicely. So let's just do it here, example-wise. So as I enter in through my little suture line right here, come out, we've got our nice bite, and as you can see, our tail is towards the superior aspect of your picture, and the needle end is down towards the bottom. So in order to keep it in the loop, for this example, I'm just going to enter from the right-hand side. My loop is going to be tied right here between the entrance and the exit point. So I've got a nice short tail, and that should be plenty for me. So I'm going to enter into my loop. Now using the tail end of my needle, I can only wrap one direction around my needle drivers. So I'm going to do a 2-1-1 knot, surgeon's knot. So now I've got my loop around there, and my tail started at the top. So now I need to pull it towards me. So we've got our nice throw overhand knot to start with. So now it works pretty well with a suturing pad, but if I want to lock it, let me just do this one first. So I can enter again from the right hand side. I'm keeping it in the loop that I'm going to be tying, coming in from the right hand side again, and as long as I'm consistent with that, I'm always going to tie a nice flat knot. So my tail started down on the bottom for this throw. Now it needs to go upward like that. And my third throw, my real locking throw, I come in from the right again into the loop, grab my tail, and now my tail started at the top for this one. Now I need to pull it down and towards me. And there we have a nice flat knot that you can see our tail and our, well, essentially both of our tails are going in the same direction. Now, nice thing, if you're tying with stiffer materials, this works out very, very well. Another example that I'll do this time is if you have a stiff material like some chromic that isn't slippery enough, that you can do a double throw and still be able to allow the knot slide a little bit before you do the final third locking throw. So what we can do here is our tail is towards away from me right now. So I'll enter my loop from the right hand side. I'll do 2 wraps right here, and see my tail is starting away from me, so I know I need to pull it towards me. But in order to keep tension on this, if it wants to open back up, which a lot of times chromic will do, and some of your other materials, I can put tension on it and I can lock it by temporarily pulling my tail end that's captured in my Castro here upward. I kind of tug it up in that direction and let go, and it keeps tension on it. So now my tail is up towards the away from me, but in reality it should be down here towards me, if that makes sense to you. But I just need to think, okay, where did I pull my tail to lock it? I started out down here, and that's where it normally would be, but I want to keep that tension, so I artificially kind of wedge the throws upward. So now I just need to enter the loop from the same direction, grab my throw, or grab my tail, and I need to think, originally my tail would have been down here. Now I just need to take it the other direction. And when I do that, finally as it starts to lock, it's going to put tension on it, and there we have it in. And now that shouldn't slip anymore. My last final locking throw, come in from the right, take a loop around it, grab my tail, bring it back towards me, and we've tied a nice flat knot. Our tails are in line with our suture, and we have nice tension on it as well. Worked out very nicely.